Hi, everyone. This is Cheryl Crow. I am a patient with rheumatoid arthritis, and I'm also an occupational therapist, and I run the patient education and empowerment company, Arthritis Life. And today I have Corinne with me. Do you want to introduce yourself?
Yes, my name is Corinne. I'm an occupational therapist in Virginia, specializing in hand therapy, and I'm the owner of Mobile OT and Wellness Group. I do in-person and virtual visits. I go into people's home and bring basically outpatient hand therapy into the home.
That's so cool. That's really exciting. And this is my hand. We have this very creative idea today. We're going to be talking about different kinds of hand stretches and exercises to do if you have rheumatoid arthritis. But very quickly first, I just wanted to say, if you're not sure, like, what is an occupational therapist versus a physical therapist, when it comes to hand therapy and hand stretches, there is a lot of overlap, not going to lie. Like, a physical therapist might tell you some very similar stretches to an occupational therapist. But our goal at the end of the day, I like to say, if I could rename occupational therapy, it would be life skills therapy, because our goal is always about helping you function in your daily life. So though we're talking about this hand by itself today, in OT, in a real session, we'd be talking about, like, okay, how does your hand hold the computer mouse? Is there a different way to do it? Or I actually have this is my travel mouse, but at my regular work setting, I have my upright mouse. So you're looking at your actual daily activities. How do you hold a knife? How do you do your makeup? Really drilling down to the specifics of your life. And that's kind of what separates occupational therapy. But today that we are just going to be going over some general exercises, but as a medical disclaimer, nothing that we say today is going to supersede or take precedence over what your individual health team recommends for you. This is just a demonstration of some of the stretches on a real patient with rheumatoid arthritis. I'm going to put my left hand so you could see my left hand as well. What does it look like on a real patient? Because I don't know about you guys, but when I see things like demonstrations, I always kind of want to know what would it look like on me. Did you want to add anything, Corinne, about that disclaimer or anything else?
Yes, I would love to. Exercise has actually been found to be effective in decreasing arthritis-related pain, improving your blood flow, and improving your actual cartilage, which is really beneficial, especially for rheumatoid arthritis. However, your exercise program, as Cheryl said, is dependent on your individual needs and your hands. For example, if you had an unstable wrist, doing a lot of repetitive wrist range of motion exercises might actually lead to rupturing your extensor tendons. Or if you have an unstable thumb, some of the exercises might cause more of a thumb deformity. So it's important to always talk with your doctor or talk with your therapist before doing any exercises and avoiding painful motion. Joint instability rather than actual weakness might actually be more problematic during activities. So if your hand is collapsing, it might not even matter that you're weak if your hand is collapsing. So sometimes, if you do have an unstable hand, an unstable wrist, if your thumb is often feeling like it needs to dislocate, figuring out how to give it stability before even exercising it can be helpful. So figuring out a good splint or a wrist wrap to wear in conjunction with doing the exercises while it's positioning you correctly, so that you can strengthen yourself in the best motion possible.
Yeah. And just to drill down even further, when you say instability, can you describe what does that act how do I know if I have instability as a patient?
That's a great question. It just might feel like it's weak. It might, if you're trying to hold something, you might notice that your joint is collapsing. And by that, I can actually show you on my thumb. I have joint thumb instability. So my thumb likes to go inward, hyperextending. If your joint is doing something that it looks like it shouldn't be doing.
I see. Would hypermobility be an example of that? Yeah. Okay.
Yeah, definitely.
Yeah.
And for the wrist, if your wrist is unstable, you might feel clunking. It might be painful popping. That's a sign of joint instability. So if you have any of that, it's really good to talk with your doctor and like do exercises under the guidance of a therapist.
Yeah, no, that's in the context, and we could do a different video on this where it's like simulating a real session. Like, Corinne would measure all of these tiny little angles, in an initial evaluation. You'd measure the angles, you'd measure my strength, my grip strength, pinch strength for all these different tiny muscles and in the hand. So the hand is extremely complex, right?
Yeah, it really is. And like
Yes.
is just very like, it depends on the person. But
Yeah.
I'm really happy today to like go over just some basic gentle range of motion exercises that you can do, especially if your hands feel stiff. If you do feel stiff and you're not in an inflamed state, heat is a good idea to do before doing your exercises, just so that it can improve like your joint range of motion. So I always recommend putting some heat on before doing it, especially if you're not inflamed.
Yeah, and heat versus cold is an interesting debate in the patient community that I think that a lot of people find that they have a positive relationship with heat, right? Because it feels warm and comforting. I do find personally, if I am having like a hot joint flare up, then cold is actually more relieving than heat. But if I'm stiff, my rule of thumb is if I'm stiff, I'll do heat. But if my joints are hot and inflamed, I'll do cold. But again, get the guidance from your providers.
Yeah, absolutely. And after doing some exercises, sometimes you might not have felt inflamed, but then if you do feel inflamed afterwards, you could always put cold on afterwards.
Yeah, and just something to show, I'm just going to put my hands up here so you can kind of see. This is my right hand and this is my left. I have had rheumatoid arthritis for 19 years now. I can't really put my hands here at the same time. I'm going to knock my tripod. Oh, there we go. My tripod is a little precarious, but one of the things that is a diagnostic, aspect of rheumatoid arthritis initially is they typically look to see if it's bilateral, right? If you have just one little finger that's hurting, might be osteoarthritis or an injury. If you have both sides, it tends to be more of a sign of something more systemic. But from the very beginning for me, so again, it's been 19 years, my right side has been more painful than my left. You can, and we could do a whole other thing of just analyzing my hands, but certainly if I was diagnosed in 2003 and put immediately on aggressive drug therapy for rheumatoid arthritis. If I had been diagnosed, 2 decades earlier, the typical progression would be much more substantial deformities or joint differences than I have. But that said, this is not, I wish I could get my sister to do a video so we can kind of have like the closest relative. This, like my range of motion and see how my little pinky kind of goes in. This is not normal. Like I haven't completely the disease is not completely in remission. Here, can I slide? I can't really slide them in, but do you want to point out anything about my rheumatoid arthritis before we do this?
I definitely feel like, I was telling you, I think maybe it does look like your fingers are trying to drift a little bit on that side. Mm-hmm. It looks like that tendency is there more so left. Are you right-handed?
I am right-handed.
Yeah. I've noticed that a lot. Like a lot of my patients that have rheumatoid arthritis, their dominant hand will progress, more quickly than their other one. Yeah.
Yeah. And from the very beginning, it's been worse on my right. Like this is the first joint I thought I had sprained before I knew I had rheumatoid arthritis. I said, I have a sprained finger.
Oh man.
Yeah.
And your right hand does look a little more swollen too.
Yeah. Like right now I am not in what we would call like medicated remission. I have like mild to moderate disease activity. And at this point, it's hard to know. Like I'll tell people, it's like, even though I'm an occupational therapist and I've had this, I'm a patient educator, I don't truly know, like at 40 years old, after this for 19 years, what should my baseline be?
Right,
like, what am I trying to achieve?
That's
like,
so hard because it's like literally been half your life.
Yeah. And I don't know, like, to me, it comes back to, this is such an OT way of looking at it, but like, can I do the essential functions of my life? Like, can I clip the little annoying clip on my dog's collar, when I need to take him out? Can I cook for myself? Can I do the basic functions? Can I put my hair in a ponytail? If I can do those things, without substantial pain and getting in the way, then, I'm okay with that to some degree. But anyway, it's all complex.
Yeah. No, I totally agree with you though. As an OT.
Yeah.
I also want to point out one more thing I'm seeing is, and this is common with rheumatoid arthritis, these MCP joints on your hands, especially that right index finger one, they're just a little more swollen, a little bit more prominent.
Yes, I am very small, like frame. You can see how tiny my wrist
Right.
is. I'm like,
yes,
I'm skinny. Look at me. But I'm saying like, this should not be that
shouldn't
big.
look like that. Yours should look more like this.
Oh, no. We could even do like a side by side, like,
yeah.
Wait, is it your left hand or your right? Oh, there we go.
That's my right hand.
Oh, okay.
Isn't that funny? That's weird that it's
Yeah.
So you can see,
trying to focus on my face.
Okay. I can definitely tell the differences.
And
across yours.
And I know that if you were like my OT and we were in an in-person session, or even a rheumatologist as part of my every 3-month check-in, she palpates. Like if my RA was in remission, I would probably be doing virtual appointments. But since it's not, she palpates, which means like she presses on it in different angles, and she can identify, and you could identify really like the degree of swelling as well. And like I remember asking her once, I said, is in a normal person, like who doesn't have RA, does it not hurt at all if you press? Because to me, it's like unthinkable that if you pressed on your joint, it wouldn't hurt at all. Wow. It's not like I'm in excruciating pain. It's not like I'm like, ah!
But you just maybe thought your whole life it should hurt everybody to be pressed on your joints.
Pressing. Like you just, that
doesn't hurt me. No.
If you press like this, that doesn't hurt. Yeah. Right. So a joint shouldn't
This feels
hurt.
like pressure. Yeah, it shouldn't. But
it gets to the point where we don't know if you've lived
what's
normal.
Yeah, exactly. Yes, definitely. Well, I think that was a good intro, and I'm happy to go over some exercises that I would typically recommend just for somebody with RA who is looking to maintain or even regain a little bit of motion.
Yes.
So the first one is just practicing bending your wrists. So if you would want to put your hand like this.
Okay.
And gently come forward. And if you need to stabilize like right here, if that helps, your forearm still coming forward.
Oh yeah. So you're not going like this.
Yeah. So your elbow's not going everywhere.
Yeah.
So usually I would recommend going through, 10 repetitions or so. If you, I wasn't counting, but if you want to count, you can.
I think I'm on 6. My hands have their own stage here.
I know.
Should my thumb just be relaxed?
Yeah, just a relaxed thumb, whatever is comfortable to you. If it's relaxed like this, or if it's more like this.
Yeah.
Yeah, whatever is comfortable.
Okay. And that was 10.
Okay, perfect. So our wrists move forward and backwards. They also move side to side. So again, I would recommend stabilizing like this, and then trying to move.
Yeah.
Just gently. You want to avoid any painful range of motion. Active range of motion, which is what this is, versus like a passive stretch, is a great way to not overdo it.
So true. So it's not a case like that, no pain, no gain, right?
Right. Absolutely. If it hurts, then stop. Your body is talking to you.
Just feel a little tension. Okay. Would you say that? Would you want to go to where you start feeling a little stretch or tension?
Yeah. Like a mild, like a 2 out of 10 tension. 2 to 4. It depends on, everything's so subjective, right? It depends on your pain scale. But I would say
that's so true. And I think that a lot of us have talked about in the RA community, like there's a different pain scale for all the different kinds of pain. Stabbing pain, I might be a 0 on stabbing pain, but I might be a 6 on stiffness.
Right.
Which is kind of like pain, but it's not hot pain. It's just,
Absolutely. Everything is so dependent. Yep. Okay. How does your wrist feel? Oh,
it feels good. Yeah, I'm sorry. I got a little scratch there. Don't worry. I'm okay. I don't even know how I got that.
Looks like you have a cat.
I know. I do, but I don't remember them scratching me.
Oh, okay. Anyway. Well, so the next one is just like gently making a fist and then opening your hand up. So I don't know if it's easier to be up here. If you do it up here.
Let's do this.
Yeah, there you go.
2 hands at once. Yeah.
If you do it up here, then it's actually going to help push some swelling out. So that might be a case for doing it up here. Yeah.
I like to call this jazz hands.
Yeah.
And it's interesting. I can feel like, especially in my right, I feel like a little bit of resistance as I go down, not pain, just a little bit of that tightness is the word I would say. Like
tightness, almost maybe because of the swelling.
Probably, yeah. But then if I could feel it kind of release a bit as I do this. So
as you do it, yeah. And I mean, sometimes even putting your arm up taller, you know, and actually making a fist and straightening it can really also help decrease swelling.
Oh, that's awesome. Okay.
But then I don't know if you have shoulder or elbow pain. I see your elbows are hypermobile.
Oh yeah. It's interesting. I think I have a look. Yeah. I mean, you've seen it. Yeah.
Side note, I have heard of like rheumatoid arthritis often being coupled with like hypermobility, Ehlers-Danlos syndrome, or like other sort of like systemic things that cause hypermobility.
Yeah, I have too. And I don't know what the if there's a causal or correlation.
Right. I don't know either.
Underlying thing that's causing both of them.
Right.
Kind of interesting, but it's good to know, like, I know that there was this article, I'll try to link to it in the show notes or the description of the video. There's an article about, like, stretching, if you're doing yoga, which we know yoga is not just stretching, but if you're doing yoga for like as a stretching exercise, that, sometimes what you're measuring is not someone's like flexibility. You're measuring like how hypermobile.
Yeah, that's true. Right.
Actually not helpful for your body to be hypermobile, extra mobile beyond like the normal joint range.
Yeah, that's true. Because then that can create like unstable joints.
Right.
Hands. Yeah. So the next one is like thumb opposition to each finger. I don't know if you want to do it up there.
Yeah, it's probably easier to just, I got excited about my third screen.
It is exciting, but I think there's a couple coming up that you can do your third screen.
Yeah. And it's interesting. I don't know if it's because we've just been doing these, but yeah, like I can feel just a little bit of this. This is my little poofy joint right now, that there's a little bit of.
Do you ever feel like tightness in this muscle right here?
I don't know, but what if I did? What would I do?
If you did, great question. You might take, a chip clip and put it right here. Have you heard of this?
No.
It releases the muscle. Yeah. So you want to make sure that it's not like this, because that's just your skin, but that it's actually down into that thumb adductor muscle. That's the muscle that like pulls your thumb in. And so if you have a tight thumb, like you mentioned, your thumb was tight earlier before we, started the show. And it could be because potentially this muscle right here is tight, and it's if this muscle is tight, it's going to hold your thumb into the hand more. So I would recommend releasing that muscle for like 2 to 3 minutes with the appropriately tensioned chip clip.
Okay, perfect.
And then that can also help it just feel a little bit looser before doing your thumb exercises.
Oh, that's so fun. Yeah. And this is like something you could be doing, like, let's say, I always like to think when I'm trying a new habit about like habit stacking. So let's say I'm brushing my teeth with my right hand. I could be doing this with my left hand in the morning, trying to think about where you
to add it
in the toaster, just kind of do some of these.
Definitely. Yeah, especially if you're like stiff in the morning. I know a lot of people that wake up stiff. Or like in a hot shower. Just do your exercises.
Oh, that's so great. Yeah, I love that.
So the next one is, have you heard of tendon gliding exercises?
Yes, but I think a lot of patients haven't. So.
Okay, cool. So tendon gliding exercises, they take your fingers through basically all of the motions that are going to stretch your tendons and ligaments out in different ways, which is important because sometimes like just closing and opening your hand doesn't necessarily get like all of the intrinsic muscles of your hands or all of the tendons. So we call them tendon glides because it just glides your tendons in all of the different motions and lengths.
Oh, and just a quick thing. So tendons are at the end of the muscle, and they attach the muscle to the bone, and ligaments attach bone to bone, right?
Yes, thank you. That's right. Yep. Very true.
So what is important, and I think we'll do maybe someday do a different video on this, but like really delving into the anatomy of the hand.
I would love to do that. Yes.
Like, yeah, because I think a lot of times we just think, or at least I thought before I went to OT school, it's like joint, probably a few muscles in there, joint, probably a few, but it's so complex.
It's so complex. Like a lot of people think all of the muscles that move your hand are in your hand, and that's really not the case. Most of the muscles that move your hand are actually down here. They're muscle bellies in your forearm. And then the tendons go from the muscles into your fingers and attach in your fingers.
If you just put one hand on here and then you can feel, oh my gosh.
Or if you go on the back and open.
Yeah. But yeah, just put your hand on. So much muscle. No, just kidding. But no, it's so true. We actually had a cadaver lab at my OT program. I don't know if you did.
We did too.
It was really, I mean, it was a really good learning experience. Like I remember kind of mechanically pulling on the tendons and seeing what was happening.
It's amazing. Yeah.
It was it was like an aha moment for me. So anyway, point being, like, we know if you're a patient with rheumatoid arthritis, you know that you have a joint condition, right? And the joint is like the space in between, the two bones. But the muscles outside of that are also having tendons attached to those bones, and there's ligaments attached to them. So sometimes what we think is, oh, it's a joint issue because it's our rheumatoid arthritis. It might actually be that the tendons, I mean, I guess it depends on where do you decide to define the joint. Sorry, the joint capsule is that space, but the joint itself can be conceptualized to include all those tendons and everything. So I think it can get confusing to know, like, what is causing my pain. That's
absolutely what is causing my pain, what's causing my stiffness.
Yes. Okay. Yeah.
Definitely.
Sorry,
and it's really helpful. You're a really great educator. So tendon glide, normally we start up tall, then come down into a hook, and then bring it.
Is it okay to do it on a?
That's perfect. Yeah, just
rapidly minimized.
Yep.
Your fingers are really flexible. Or is that normal?
They are. No, it's not. That's not normal. I'm very, very weird.
Yeah. Oh.
Yeah, I know. My thumbs hurt often. No, it's okay. So we go
you have lived experience. So
yes, I do. Just like you do. So hook and then full fist. After the full fist, we bring it to a tabletop.
Okay.
And then we can come back. Oh no, sorry. Tabletop, flat fist. So like if you were to try to one-handed clap, that's what the flat fist is.
Oh, yeah, I can feel that it's doing different stuff. I'm trying to coordinate and watch this at the same time. I was like trying to pat your head and.
So that first one was rough. Let's do that again.
Okay, yeah.
Straight up tall, hook, full fist, tabletop, one-handed clap.
I've never heard that, the one-handed clap. I love that.
I feel like flat fist is just hard for people to sort of conceptualize.
Yeah.
Hook, fist, tabletop. So we're really trying to get that right angle. And then
that's as good. Sorry. This hand.
No, you're good. And then one-handed clap. And your thumb can just sort of stay out of the way. Like it can be hard to figure out what to do with that thumb during these, but mine just normally stays sort of in line with the hand, comfortably out of the way.
I'm sorry, I'm interrupting ourselves.
No, you're good.
Can you put your fingers in what does it look like when you curl your fingers in? So I remember when I was like a hand model for the medical school. They had to get patients come in. I remember them saying they could tell my deformity a little bit just from looking at this, because it's like, this one's not totally straight.
I do see it a little bit. I do. And your hands, when you make a fist, they're supposed to sort of drive this way.
Oh, that's right. Yeah.
And so with the ulnar drift, oftentimes that pushes the fingers like more. I can't even really do it, but more, almost more in line with the hand, like straight down.
And when we say ulnar drift, ulnar is the pinky side. So the deformity that happens with rheumatoid arthritis is over time, if it's not controlled, your fingers kind of curl and go, the knuckles drift towards that pinky side. Yeah. Mine's
it actually starts like at the wrist.
Oh, the wrist.
Usually it does start at the wrist, like it will do sort of like a zigzag, like your
Mm.
wrist will sort of go radially or towards the thumb, and then your metacarpals or the bones right here will shift that way, causing your fingers to shift that way. So I actually have a client with pretty significant ulnar drift in just her dominant hand. Her other hand does not have it. And she's amazing. She's a weightlifter. So she really wants to focus on the specific muscles that are like opposite of the ulnar drift. And she wanted to know like ways to almost try to counteract it. Not that we don't know that that's a possibility, but we've been exploring that. And so with ulnar drift, you want to avoid strengthening or moving in this direction because we're already over there. We need to come back this way. So for patients with ulnar drift, one of the first things that you can try is in a gravity removed plane, which just means we're taking gravity out of the equation to make the movement easier. You can just put your hand on the table. And so if your hands are over here with the ulnar drift, you can try to like bring each finger individually back in line. And with her, because she has, such significant ulnar drift, we actually discovered that putting like Vaseline or lotion on the table is a way, because her fingers don't not all of them will even move in this direction. Although we've gotten the ring now, but the ring was like not moving. But with the lotion added to it, we got
fascinating.
it. Yeah. So just trying to work those fingers, just active motion back to the center.
Nice. That's great. Yes. And I know that when I posted for my ABCs of OT post for OT month, I did for you, it was ulnar drift. And a lot of people didn't even know there was a name for it. I just call it pinky drift sometimes, but
yes.
It's another reason, like I actually demonstrated the wrong way earlier, but I'm like, if you're holding, let's say like holding your water bottle, gravity is like kind of constantly pulling down.
It is.
But so you can try to like do things like maybe holding it like this or two hands kind of like this, or with a coffee mug, like instead of holding it with I don't have one right next to me, but like holding things with the handle, you can hold it like with your hands like this, so that trying to avoid that position, it's called the position of deformity. Any position, whether it's like, it's not necessarily you're just doing this, like when you're just putting your hands up, it's holding things. It's like more subtle. You're like, oh yeah.
Because of gravity.
Or guess what? Your cell phone.
Yeah,
big
for
one.
sure.
How do we normally hold our cell phones?
Right.
Totally.
So do you usually recommend like pop grips?
I like a tripod.
Oh, okay.
I think because that bypasses the hand altogether. But I know a lot of patients have told me that they like it. I don't like that because it still puts pressure for me on my, I like feel
extensors,
it on my
over your knuckles.
Yeah. So, but definitely do what works for you. Many patients are able to tolerate it. I just, also because I do so much videoing, I don't want
you do a lot more
because then it can't go in my tripod.
yeah, for sure. So, if you have ulnar drift and you've mastered that tabletop motion of getting your fingers back in line, you could try, I don't know how you want to demonstrate this, but I can show you this way. So you can try, like, for example, hanging your hand over a table, which this is not a good demonstration, but if this hand were a table, you can try to put gravity back in, right? So if we are trying to move them back up this way, then we're resisting gravity now, and it's a little bit more difficult to do that motion.
Oh yeah, it is.
Against gravity. But once you've mastered that tabletop one,
it's harder.
Yeah, it is harder. Then you could try that.
It's hard. It's hard to get, because certain of the flexors and extensors, they go to both the pinky and the ring. So sometimes it can be hard to move just the ring independently. You're like, oh, I want to come over. Nope.
Yes, definitely. A way that actually you could add strength to that is like a rubber band would be like sort of the final way to strengthen it. So like,
next
I know
level.
it is really next level, and like it's really hard for even me to do. But we've explored that as well. And
but that's such a beautiful demonstration of how in the series or in the process of therapy, you kind of you upgrade the challenge over time.
Right, you do. Yeah, absolutely. Definitely. So usually it's like with osteoarthritis, this joint right here tends to be isolated, but it's often common with rheumatoid arthritis as well. It's like obviously other joints involved. But if you have arthritis in your thumb, that can cause this like instability or like a deformity when you're trying to do things. So what's important to do if you have arthritis or if you have an unstable or painful thumb is to try to strengthen the muscles that are around the thumb. So trying to lift like your index finger away from your hand. And it doesn't really matter like the position of your index finger. Like if it's more comfortable completely straight, or if you wanted to just have like a curve.
Yeah, okay, that's fine.
Just your index finger.
Okay.
You should notice that muscle right here.
Oh,
contracting.
yeah.
It gets a little beefy. That's your first dorsal interosseous muscle. And that's a muscle that is often weak in patients with arthritis, but that's one that really does stabilize. It comes down here and it attaches right here, and it helps bring some stability to that first joint of your thumb.
If you look really closely, you can see it moving.
Yeah. I do see it.
Oops, there you go. That's what's fun is feeling it. It's called palpating. If you feel the muscle, you can know that you're.
Yeah. So like, 10 reps of that. And then the other muscle that helps to stabilize the thumb is this one right here.
Oh, yes.
Yeah. And so trying to like make a C, which is like really hard for me to do because of my thumb issues that we've talked about.
Yeah.
Like what I have to do is almost try to create like a bend right here.
Oh, okay. Sorry.
Because mine wants to collapse. So if you see.
And I also injured this joint swing dancing. So there we go. Should I do it like that? Okay. Oh.
Like you're going to hold a coffee mug.
Okay. Yeah.
Or a cup. Yep. So you could do like 10 reps of this. But I often recommend just also trying to do a sustained hold of the C in the correct form. So
you should feel it like here, that meaty part.
Like right here, not so much here.
Oh, here. Oh, okay.
Outside. Here on the outside like that. Yep.
Oh, yeah. Oh, okay. I do feel it there now.
Right there. And you can probably, feel it contract when you do that.
Yeah. Oh, oops. And my fingers want to help. Yeah. I feel like a Muppet for some reason. Sorry.
That's funny.
Whatever makes sense, because I used to work in pediatrics. So I'm used to like making everything into like animals,
stuff. Yeah. And then there's one more stretch that you can do if you notice that your fingers are having the beginnings of what we call swan neck deformity, which just sort of means that this middle joint in any of your fingers is like almost hyperextending like that. And then this one is like flexing. So if your fingers tend to want to go like this, right? A really good stretch for swan neck deformity, especially in the early stages of it, is this.
So you're going the opposite direction.
Right. We're sort of counteracting that. We're stretching the intrinsics of the hand. And of course, I'm hypermobile, so mine go way back. I'm doing all of them together, but you could also just sort of individually do it. And, you'd want to hold for 10 or 15 seconds before switching on to the next finger. Again, you don't want to overstretch, especially like with passive range of motion, it can be hard to tell.
Oh, yeah.
So I would recommend just sort of starting small and then maybe slowly inching it back a little bit more. Do you have any questions?
Oh, no, I think anyone who's watching who has questions, definitely put them in the comments, because we love to hear from people, what burning questions they have. Again, if anything's hurting while you're doing these, stop and get some guidance. Most in the United States, many health insurance plans do cover, occupational therapy or being seen by a hand therapist or hand specialist. And so, and unfortunately, I think because the drug therapies, I'm evidence of the fact that the drug therapies have gotten so much better for rheumatoid arthritis. But one of the downsides of that is that sometimes people aren't referring patients to occupational therapy as much.
Yeah.
Because they think, oh, well, they don't need it because they're going to do well on the medications, which it could be the case, but it could not, and like, I wish if I could have done something differently, I would have gotten some help from an occupational therapist earlier, because at least I would have known how to prevent things and to use some, again, these range of motion and stretching and strengthening exercises that's just helpful overall for your joint stability and joint strength and everything. So because if you have rheumatoid arthritis, even if you're doing well with your current therapies, you're still more susceptible to developing osteoarthritis later and everything. So
absolutely. Yes.
Yeah.
It's been a pleasure. I've loved it.
It's so much fun. Thank you. And make sure to follow Corinne at Mobile OT and Wellness Group.
Thank you. And all of my friends follow Cheryl, please. She's amazing.
Yes.
Wealth of knowledge.
We love sharing our knowledge in entertaining and educational ways.
Yes.
Yay.
Yay.
Okay, bye-bye for now.
Bye.